Welcome back to the Wheel of Wisdom Health Fair. I'm your host, Kai, and the Grand Wisdom Wheel spun another winner for us. Today's episode is all about managing menopause and understanding those changes that come along. $1.8 billion. That's how much money is estimated to be lost each year in the U.S. from missed work days due to menopause symptoms. And currently, there are only two FDA drugs on the market to treat hot flashes in women. And one is an antidepressant, and the other was just approved last year in 2023. So we have some work to do. A recent study surveyed menopausal women to understand their knowledge and feelings about menopause. The findings: 94% were never taught about menopause in school, 49% didn't feel informed at all, and 16% were dreading it. Surveys like this reveal a knowledge gap. It underscores why I started this channel. We're navigating through common yet often undiscussed topics like menopause, empowering you with the information you need. Often called the change of life, with 1 million women in the United States experiencing this each year, every person with a uterus undergoes menopause, most commonly at age 51, but some have experienced as early as their 30s. There are 3 phases. Perimenopause is a stage lasting several years when estrogen production starts to decline. Menopause itself is when your period stops for 12 consecutive months. And postmenopause begins 12 months after your last period until the end of life. So why does menopause happen? It's primarily due to ovarian failure and the reduction of ovarian follicles, which are the main source of estrogen. This decline of estrogen triggers various symptoms. So let's talk symptoms. Hot flashes, experienced by 75% of women and can last for 2 or more years. Night sweat. Some women wake up drenched in sweat, having to change night clothes and their sheets. Vaginal dryness can lead to pain during sex, inflammation, and UTIs. Urinary urgency, the pressing need to pee more frequently. Cardiac effects like dizziness, palpitations, and fast heartbeats. Changes in hair growth, like an increase in facial hair or thinning of hair on the scalp. A variety of mental health challenges: insomnia, mood changes, irritability, depression, anxiety, fatigue, difficulty concentrating or memory lapses, weight gain and bloating, dry skin, dry eyes, dry mouth. Tender breasts and loss of breast fullness are common during menopause. Changes in hormones can lower libido and affect sexual desire. Aches and pains in the joints and muscles, headaches, and relaxation of pelvic muscles can lead to bladder issues and pelvic organ prolapse, which is when the uterus or bladder can actually drop down into the vagina. That was a comprehensive list, and I don't aim to overwhelm anyone, but some may be experiencing symptoms without realizing they're actually tied to menopause. It's good to have open discussions with your partner and family so everyone can be aware of the normal and expected changes and prepare accordingly. Some have fewer symptoms, while others' experiences are far more severe. Everyone is different, and managing menopause is unique as well. Tell your healthcare provider your concerns and what symptoms you're experiencing to create a personalized treatment plan. And some may not need treatment, but for others, it could be a game changer. So what are the main types of treatment? To keep it simple, the 2 categories I'll talk about today are hormonal and non-hormonal. Hormone therapy helps in compensating for the estrogen decline, which is very effective for managing symptoms like hot flashes, vaginal dryness, and even preventing osteoporosis. Medication containing hormones estrogen and progesterone replaces those same hormones your body is losing during menopause. This treatment, available in pills, creams, patches, gels, and sprays, is not one size fits all. It should be tailored to individual needs and periodically reevaluated to ensure the benefits continue to outweigh the risks. What are the risks? Endometrial cancer, breast cancer, gallstones, blood clots, stroke. To minimize these risks, many advise to start hormone therapy within 10 years of menopause and before reaching 60. Opt for the lowest effective dose for the shortest time period, especially if you still have your uterus. Of course, stay proactive with regular mammograms and pelvic exams. Always consult your healthcare provider because your treatment plan should fit you. Now, if hormone therapy isn't your cup of tea, there are non-hormonal options. Non-hormonal treatments are often suitable for those with other medical conditions or who have recently been treated for breast cancer. Your provider may recommend dietary changes, identifying and avoiding triggers, especially for hot flashes, staying active, joining support groups can provide a sense of community during this time. Prescription medications, Brisdell and Veoza are two FDA-approved medications that can be used for hot flashes. Vaginal moisturizers for relief from vaginal dryness, and pelvic floor therapy if you experience urinary incontinence. Lastly, I want to shine a light on the long-term health risks menopause and postmenopause can bring. Menopause isn't just about hot flashes and mood swings, it can also affect your bones. Osteoporosis, often described as brittle bone disease, is a real concern. As estrogen levels drop during menopause, your bones become less dense and more fragile, making fractures more likely. To assess your bone health, your healthcare provider might recommend a DEXA scan or bone mineral density testing. This quick, painless outpatient imaging test uses x-rays to measure the amount of calcium in certain parts of your bones to check for osteoporosis and osteopenia. Now, let's talk about another concern, your heart. Fun fact, estrogen provides a protective effect against heart disease. So when the estrogen levels decrease during menopause, the risk of coronary artery disease increases. Regular checkups and discussions with your healthcare provider starting early on can help monitor and manage these risks. Reflecting on this episode, did anything surprise you? If you've already experienced menopause, what advice would you give to others entering into this phase of life? If you haven't, what aspects of managing menopause are you anxious about? Feel free to ask anything or share your experiences in the comments. And that wraps up our Wheel of Wisdom Health there on Mastering Menopause. If you like this video and want to see more, remember to hit that like button and subscribe for more health content tailor-made for the golden years. Until our next spin, stay cool, stay healthy, and keep embracing the wisdom of the wheel. Bye.